let's see here. Give me just a minute. I'm just curious, are you guys seeing my small screens with the waiting room and meeting chat?
No, just your PowerPoint.
Okay, good. And so you're seeing the PowerPoint?
Yes.
Yes.
Okay, so I'm going to go ahead and admit all, and then if you guys can just help me admit people as they come in. There's 22 people, so we'll go ahead and get it going.
Sounds
Thanks,
good.
guys.
Thanks, Bruce.
Okay. Okay. Well, good afternoon, everyone. I'm Bruce Lloyd, ACHE of Georgia's Executive Director, and it's my pleasure to welcome you to our webinar titled Leveraging Community-Based Partnerships to Activate Strategies, Initiatives, and Programs that Address Health Disparities. Before we get started, I just have a few announcements, and I'd like to begin by recognizing our annual sponsors. Our platinum sponsors are Atrium Health Navicent, Grady, Moss Adams, and Wellstar. And we're fortunate to have a Wellstar panel on today. Our gold sponsors are ACT Talent, Grant Thornton, Healthcare Program Advisors, Piedmont Healthcare, Northeast Georgia Health System, and Visia Technologies. And our silver sponsors are DT Spade, KCA Firm, Vivleo Health, Georgia Nurses Association, Metro Atlanta Ambulance, and SSR. Then we have some events coming up. The big one is next Thursday, May 16th. It's going to be from 11:30 to 2 at Maggiano's. The role of data and advanced analytics in transforming healthcare. There's an hour and a half of HEHE in-person education credit. And by the way, Monday is the deadline to save $10 on the registration. The fee goes up on Tuesday, another $10. So hopefully we'll have a good turnout for that. And just as an aside, our Toastmasters group is going to be meeting in the same room from 2 to 3 that day. So if you're interested in our new Toastmasters club, just stay over for that. There's no charge, and you're certainly welcome to attend. And then mute that microphone. Okay. And then on June 6th, we're doing another virtual interactive program. And we just opened registration for that, and that's on our website. So hopefully you can attend that. You can register for all of events at acheofgeorgia.org. To encourage our members to take the Board of Governors exam, our fellow advancement committee is offering an online archive of last fall's prep class for $50. And details for that are on our homepage. We offer several ways for you to stay connected via social media, via LinkedIn, Facebook, Instagram, and Twitter. And we'll also like to invite you to get involved with one of our committees. And you can see here we have, I believe, at least 10 committees. So if you'd like to join one, you can just reach out to me and we'll get you signed up. Okay, today's program offers 1 hour of ACHE qualifying education credits, and you can self-report those credits in the My ACHE section of ACHE's website. Okay, now it's my pleasure to introduce Glenda Francis, DNP, MBA, HCM, CCRN, NEA, BC, FACHE, CHE, Director of Community Health Operations for Wellstar Center for Health Equity, and she will be on our panel along with Elise and Rayanne. All right, Glenda, you want to take over?
Yes. Good afternoon, everyone. I will have my partners introduce themselves to you, Elise and Rayanne.
Good morning, everyone. My name is Elise Lakami-Kassem. I serve as the Assistant Vice President for Community Health and the Center for Health Equity here at Wellstar Health System.
Good afternoon, everyone. My name is Rayanne Pinkney. I serve as the manager for community health in the Center for Health Equity. And it's a pleasure to be here with everyone this afternoon as well.
You can go to the next slide, Bruce. Here at Wellstar, we usually start collaborative meetings with a connect to purpose. So I want to briefly share a connection to my purpose. So my grandfather migrated from Johnston County, North Carolina, up to Brooklyn, New York during the Great Migration of African Americans to the North in search of good union jobs to support his family. When he arrived in Brooklyn, my grandfather planted himself in a neighborhood that wasn't quite resourced. They didn't have trees on the block. They had limited safety patrols from police and a host of other challenges. And he, along with my grandmother and others, became foot soldiers for revitalizing that neighborhood and community. And by the time I was in elementary school, my grandfather was retired. And so he devoted all of his time to community building. And I was tasked with handing out flyers for the next neighborhood meeting or getting people to sign a petition. And it is in that ethos of boots on the ground community work that I embark on the health equity journey within Wellstar. We have two population health trends working against us in this nation. And you can go to the next slide, Bruce. The first of those trends is that people in the US live shorter lives and spend much more on healthcare than people in peer countries. In fact, since 1930, there have been 56 countries that have surpassed the United States in life expectancy, including Cuba and Thailand, Kuwait, Slovenia, and a host of others. Next slide, please. Just a couple weeks ago, the media reported that for the fertility rate in the United States is at the lowest it's been in more than a century. So another population health trend working against us. The total fertility rate in 2023 remained below replacement level, which indicates that this generation of people, we cannot exactly replace ourselves. So these statistics that I shared are even more dire for communities of color and residents of particular zip codes. Those zip codes are reeling from the effects of unforgiving government-sanctioned policies like redlining. Next slide, please. This is a picture of a regional picture of our Metro Atlanta area. And as you can see, your residence, your zip code, your census tract is a better predictor of your life expectancy than your genetic code. Next slide, please. Across a variety of health measures, Black and American Indian or Alaska Native individuals continue to fare worse compared to white individuals across most measures of health status, including physical and mental health, birth risks, infant mortality rates, HIV and AIDS diagnosis, and death rates. And the prevalence of death rates due to certain conditions continues to be worse for those communities. Next slide. So why? Why do we see these differences? I already mentioned to you redlining, which was a policy whereby certain communities were flagged for investment while others were not. So at the top of that list, they said invest in the communities that are white Anglo-Saxon. Those Irish communities, maybe we'll have them in the middle. The Black and Indigenous communities at the bottom of the list for investment. Other things are root causes of what we observe. I want to hone in on individual and behavioral factors and give you an example. So there was a community in middle of Atlanta where historically they did not have access to food. And a Trader Joe's came along as a neighborhood grocery store. The residents of that neighborhood who identified as Black and African American were coached by some community health workers like, hey, you can get nutritious, low-cost food right here at this grocery store. And the individual said, oh, I didn't realize that that grocery store was for me. And so in the work, there are ways that we have to strengthen how individuals perceive themselves and in their access points to improve the health outcomes that we see. Another emerging root cause that we're learning more about is called weathering. Weathering, according to the public health researcher at the University of Michigan, it makes the case that communities that are Black and African American or other are living in chronic stress that is weakening their bodies at a cellular level over time. So most of us, when we experience stress, can go to spaces where we get social support. As a Wellstar team member, I can lean into the free counseling we have through our Spring Health Relationship. I can lean on my partner. Some people don't have social support, and so those levels of chronic stress just compound and compound and compound. Next slide, please. Decades ago, the World Health Organization identified those factors that influence health but may not exactly be a health-related issue as social determinants of health. And you see the categories listed here. By addressing social determinants of health, health delivery systems, hospitals, others can improve the health outcomes of the traditionally medically underserved communities to a greater degree than just by delivering clinical services alone. Next slide, please. Since the Institute of Medicine's groundbreaking report, this was, if I think back to when I was in graduate school, we're talking the end of the last millennia, right? That there was a report on the unequal treatment of individuals in healthcare. But since that time, health systems have devoted efforts to optimizing the level of health of all people, including those who may or may not be patients. And so at Wellstar, we really lean into our community health needs assessment to improve the surrounding community, knowing that these individuals, even though if they may not ever make it inside of our institution for care, they're still a part of the community surrounding where we serve. You can go to the next slide. So our robust approach for the community health needs assessment is in concert with the Georgia Health Policy Center at Georgia State University. So they help us complete a comprehensive CH&A process, which includes a synthesis of secondary data specific to the populations around our hospital footprint. We do literature reviews. We do primary data collection through surveys. We have key informant interviews with community leaders. We have community summits with lay community persons just to get a sense of what is happening in and around where we serve and how do we elevate the health of all people. Next slide, please. Our 2022 Community Health Needs Assessment identified the following as leading kind of vulnerable populations where we serve: people of color, particularly Black, Hispanic, and Indigenous communities, members of the LGBTQ+ community. Wellstar, we have our footprint also in Spalding and Sylvan Grove areas, also in Troup County, West Georgia. So residents of our rural communities are really at risk for negative health outcomes. We also know that households without access to reliable broadband internet are also particularly vulnerable. Next slide, please. Using that data, we rank zip codes among a community need index. Deeper purple means worse off. As you can see, we have a diverse footprint, and those deeper purple communities need more support for income access, cultural resources, educational pathways for attainment. We need more insured individuals in those communities, and there are housing needs as well. We use this map to target the initiatives and programs that you'll hear more about in just a bit. Next slide, please. Our community health needs assessment pulled out focus areas. We learned that there's exacerbation of chronic disease everywhere we serve. We know, of course, Georgia has a high maternal mortality rate. That came across in our data. We also know there's low food access across our footprint, and you'll hear more about how we've prioritized that work as a strategy for the 2022 to 2025 period of work related to our needs assessment. Next slide, please. After looking at all the data, you've heard how we collect it, what it pulled out. We work with a community health council to help us prioritize where we focus our efforts. Leading things that came up for across our footprint included access to healthcare, behavioral health, women's health, housing, poverty came out as an issue, cancer, STDs, STIs, and the list goes on. Next slide, please. And so now you'll hear from Glenda Francis about what our strategic priority areas are and how we focus the work. Glenda?
Thank you very much, Elise. The implementation plan emanates from the Community Health Needs Assessment and depicts how we partner with community-based organizations. Hereafter, you may hear me affectionately referred to Community Health Needs as Jenna. The goal is to activate system-wide initiatives, strategies, and programs that are address health disparities in communities. So Wellstar is utilizing an upstream approach, actually resolve some of the issues that we're facing in the communities we serve. Next slide, please. Next slide. No, back again. Go to strategic implementation. There you go. Perfect. The strategic implementation plan addresses the priority health needs of the community health needs assessment. Wellstar has adopted a two-pronged approach. As you can see, we focus on community-driven solutions and sustainability infrastructure. This approach seeks to improve community conditions to support health equity and foster health for everyone. We are quite aware that health inequity is a complicated and complex issue. No one organization, policy, or program can solve these problems alone. So using a collaborative approach, Wellstar has created strategic partnerships with government agencies, as you can see here, businesses, philanthropic organizations, nonprofits, and citizens to make a meaningful difference in our communities. So we utilize both internal strategies as well as external strategies. Next slide, please. The following strategic domains were evaluated as priority for the community that Wellstar serves. Strategic domains inform the Wellstar Center for Health Equity, and you would hear me refer to that as the center going forward. So it informs us regarding how we deliver care, internally, of course, and externally. By adopting a shared vision, Wellstar hopes to achieve significant and lasting change. Together, Wellstar and strategic partners address health inequities, such as access to care, as Elise mentioned, and you see in this slide, behavioral health, food access and healthy living, housing, pediatric, and women's health. As you can see thus far, health equity is viewed as the true north for the center. Through this Wellstar Center for Health Equity, Wellstar strives to address, impact, and make lasting change for health inequities across Georgia. By putting system-wide initiatives and programs into action, the center helps enhance the health and well-being of the communities we serve. Next slide, please. I will highlight some core programs and clinics as we move forward. Next slide, please. Next slide. We are talking about access to care going forward. So I will highlight 4 of our core programs, and as we move forward, I will start with the Community Health Needs Assessment, which actually support care linkages for communities with limited healthcare access by maintaining and creating formalized relationships with community safety net clinics. A couple years ago, we worked very intimately with one clinic that experienced significant challenges in expanding the bandwidth to hire a more robust interdisciplinary team. They just didn't have the resources, and subsequently, Wellstar got together. The foundation donated $150,000 to that particular clinic to expand their reach to serve the patients in their population. So next slide, please. I'm going to talk here, of course, Community Health Clinic Network. The network was implemented to support community residents with little or no access to healthcare. And the goal is to promote health and wellness and to facilitate opportunities for residents to reach their maximum level of healthcare, again, our true north. There are multiple clinics within the Wellstar footprints, which I will share with you as we proceed, delivering affordable cares. Clinics are interconnected by engaging in quarterly meetings sponsored by Community Health, and I will share a little bit more with that when we get to another program. So next slide, please. We'll talk about congregational health. The Congregational Health Network and its strategic partnership we will discuss. I will share some of the many ways in which we leverage the Congregational Health Network and communities. The Wellstar Health Congregational Health Network was brought in August of 2000, and it's managed and coordinated by an RN with specialized training as a faith community nurse. It also serves as a bridge between our healthcare system and faith communities, offering help and support with lifestyle changes, personal habits, attitudes, faith, and well-being. Congregations are often used as launching pads or deploying sites for most of our outreach programs. Through internal and external partnerships, the network is better positioned to meet the needs of the faith community it serves. Together, we address health disparities to include members and surrounding communities the churches serve. The network is designed to assist congregations of all faith in implementing service-based and evidence-based healthcare and wellness programs at no cost to them, such as cancer education and screening, which we'll talk about in a little bit, mental health classes, educational outreach, personal one-on-one education, and actually sponsoring speaking engagements. Next slide, please. So here we talk a little bit about one of our core partners, Black Health. Black Health, we'll talk about colorectal cancer, of course. Black Health is a group that works to educate consumers about the risk of colorectal cancer. The goal is to increase awareness, access to screenings, and educational resources for CRC in the medically underserved communities. The program urges people to get screened at an early age. The focus on colorectal cancer emerged after the death of 43-year-old Chadwick Boseman, and also after a study revealed that there was an increase in cases in the African-American community. Today, Craig Melvin, who is the founder of Black Health, reports and spreads awareness on colorectal cancer. Wellstar serves as a partner on the Good Down There campaign, a national project created by Black Health and Cottonelle to reduce barriers to care for those diagnosed with colorectal cancer. Clinics in high-risk communities distribute free at-home screening kits, which are utilized in the privacy of the participant's home. We have thus far distributed over 1,900 kits, and 58% of those receiving the kits never had any previous screening. We also have a new partnership I just briefly mentioned here with Lab Outreach to screen those for presenting with symptoms of prostate cancer or just screen them, period. We partner with the urology service line so they can have actually treatment. But as you can see here, we're closing the gap. And 40% of the kit recipients indicate being uninsured. 15% indicated not having a personal doctor. They are medical orphans. 46% indicated not being previously screened. 22% previously screened, not previously screened, indicated no access to a fit test. And 9% of the fit tests returned a positive result. So you see, we make incremental changes for long-lasting impact. Next slide, please. So here we are going to talk about the Community Transformation Program. That's a program that was developed as a Tequity initiative. The goal is to increase access to healthcare and social support through technology. by partnering with community organizations that have innovation needs. The center increased funding for the program, expanding it from 5 cohorts in FY22 to 7 in FY24, and the cohort program lasts for 1 year. The current cohort has also been granted access to an incubator accelerator led by Goody Nation. This mentoring resource is offered to multiple organizations as an added benefit to participation to support each of their sustainability plans. The collaboration with Goody Nation is designed to create a sense of community for the cohort members and to share focused access to capital and other resources which the organization may not otherwise be aware of. We host coffee conversations at the midpoint level during the program. And again, we host a summit at the end. And this is basically to highlight the work of the community partners, where each organization shares their progress and challenges with Wellstar leaders and team members. So as you can see here, we have small solutions, but they create very big changes. And in the words of Muhammad Ali, I would like to leave you with this as I shared our partnership in the next slide. Muhammad Ali said, not the mountain ahead that wears you, but the pebble in your shoes that is the challenge. So Wellstar is addressing the pebbles in our shoes by partnering with these organizations like Good Sam of Cobb, Kellink of Northwest Georgia, Rock Springs, Griffin, the Cobb and Douglas Public Health, Someone Cares of Atlanta, Black Health, True Cares of True County, the Care Place, Bethsaida, and the Empowerment Center. So here you see some of our partnership, and now I will punt to Rianne Pinckney, who will discuss some additional prioritized programs that we have in the center. Rianne? Next slide.
Thank you, Glenda. And next slide, please, Bruce. I will dive in a little bit about our behavioral health portfolio of work. Next slide. As a community, the pandemic brought to the forefront more than ever the importance of caring for our body and our mind. As a response to our CHNA, Soul Support was created to strengthen our communities by increasing access to behavioral health education, training, and resources to congregations across our Wellstar service area. Soul Support leverages mental health first aid and QPR, a suicide prevention workshop, to educate leaders and members of various congregations on signs and symptoms of suicide, as well as how to help or support somebody in a mental health challenge or crisis. Powerful Tools for Caregivers is a part of the Soul Support offering, and it is in partnership with ARC, helping individuals caring for their loved ones with fellowship and resources to decrease burnout. I'd like to note that to date, 428 community members have been successfully trained in mental health first aid and QPR. And with the generous support of Molina Cares, Soul Support is now able to expand out and provide free telebehavioral health services that we partner with Summit Counseling Center and Empowerment Resource Center to do so. Next slide, Bruce. And these are some of our system partners on the behavioral health front. Next slide. Food insecurity is defined as the condition of not having access to sufficient food or food of adequate quality to meet someone's needs. And I'll dive in here on the next slide. Our food access ecosystem addresses food insecurity through 3 main areas. First is our food rescue program in partnership with Gooder, in which we aim to reduce our food waste footprint. Since 2021, our hospital cafeterias have diverted over 26,000 pounds of food from landfill to local organizations who serve community residents in need. Again, in partnership with Gooder, our mobile markets series serves over 4,000 households across 5 months each year, where they're able to be provided with free groceries and free healthy foods and education to support them along their journey. And lastly, on the food access ecosystem, We are privileged to have a partnership with Wholesome Wave Georgia, in which we share a bilingual benefits specialist who can then take support of SNAP applications and government assistance benefits to the individuals that we serve through our mobile markets, but also through our GME clinics. Next slide. And these are our health system partners when it comes to food access. Next slide, Bruce. So I'll dive in a little bit about our women's health portfolio now. And on the next slide, you'll be able to see a high-level overview of 3 community organizations that we partner with to address key women's health needs, such as maternal health and period poverty. And on the next slide, I'll dive in to share a little bit more about our inaugural program in that portfolio with Healthy Mothers, Healthy Babies Coalition of Georgia, where we've partnered with them to support the distribution of perinatal care packages. Care packages equip birth givers with vital tools and resources to thrive and survive during pregnancy and postpartum. Through this care package, birth givers are equipped with a blood pressure monitoring device, and this resource has been proven to show a huge impact in the community. A key example of this is with our Wellstar doula program patient who delivered and at post-discharge became very unwell. She was able to use her BP monitoring device, in which she received from her perinatal care package, and found that her readings were elevated. Through connection with her doula of the Wellstar doula program, she was advised to go back to the hospital, where she was subsequently admitted for postpartum preeclampsia. And as some of you may know, if left untreated, can mean fatal circumstances for a birth giver. Through this resource and the trusted relationship with the Wellstar doula, this birth giver was able to obtain the care she needed and prevent worse outcomes from happening. Care packages are accessible to the public across the state through Healthy Mothers, Healthy Babies Coalition of Georgia. They can be requested each month on their Pickles and Ice Cream website. Next slide, please. And these are our health system partners as it relates to our women's health work. And now I'll dive into more about how we plan as a system to address social determinants of health. As Elise mentioned before, social determinants of health are the conditions and environments in where people are born, live, work, and play, and can really have an influence in our health outcomes. Next slide. So Wellstar has made an investment into Find Help. Find Help is a national platform. It's an online tool to further help with resource connection as it relates to Find Help. So individuals can go on, put in their zip code, and there'll be a category of different SDOH resources such as housing, transportation, and food access. The uniqueness of Find Help is that we can actually be more intentional about how we refer patients and our community members to the resources they need, as it offers an opportunity to have a closed loop referral system. So meaning we now know and can keep track of the resources that we're providing to patients and community members and ensure that they've actually made it to those resources. So Wellstar has a lot of exciting work coming to the forefront about Find Help and how we want to really intentionally address social determinants of health and join some of our other healthcare system partners in doing that. Wellstar does have their own site, wellstar.findhelp.com, but you can also leverage the national site through findhelp.org. Next slide, please. And I'm going to pass it back over to Elise, who will close us out on best practices and how we measure success.
Thank you, Rayanne. Next slide, Bruce. As you heard Glenda Francis share, we do have a true north. And so at the Wellstar Center for Health Equity, we aim to improve access to care and social care resources for community members. We are on a roadmap of measuring success in community health in the following ways. So 1, we want to make sure that we are reaching people who reside in these deep purple zip codes depicted in this map. Those are our high need zip codes that were outlined in our community health needs assessment. We also want to make sure that we are intentionally reaching out to individuals who are members of historically medically underserved communities. So those are those communities who have are experiencing their unfair share of health burden. So I want to give an example. When we did the COVID-19 testing and outreach in partnership with the Department of Public Health, we know that Black and African American and Hispanic or Latino communities were not receiving tests and vaccinations at the same rate of white community members. And so through our targeted outreach through churches, we had an overrepresentation of Black and Hispanic community members receiving testing and vaccination. So we count that as a success. Additionally, our partnership with Black Health that Glenda referenced, we did not say, hey, if you're Black, then you're the only one who could receive a colorectal cancer kit. In fact, we just leveraged our relationship with congregations in some of our high-risk neighborhoods and zip codes and broadly distributed these resources. But through our approach, we're able to reach 90% of the kit recipients identified as Black or African American. We also aim to increase the proportion of people who indicate improved access to care or social support services after engagement with us. So with the use of the tool Find Help, we're going to be able to survey individuals at the start of their partnership with our programs, and then at the end. And we want to, in how we design what we do, make sure people can say, yes, I am now better connected to a medical provider, doesn't have to be Wellstar, or I'm now better connected to a food resource as a result of being in partnership with Wellstar Community Health. And so that's how we're measuring success. We communicate these successes to our board members, whether they're regional boards of hospitals or our larger board of the health system. We are now communicating these results scientifically through papers. So we're on the road to publishing our results from the Black Health Partnership. We also communicate these results and are starting to communicate these results to partners themselves. Many of our partner organizations, I'll call one out, our Women's Health Partner, Healthy Mothers, Healthy Babies, they're busy doing the work and don't necessarily have the time to analyze or visualize the impact that they're making. And so we partner with them and say, hey, our team can help you map your data and share that storytelling platform so that they can be better equipped to go to additional funders to be able to serve more people. I want to thank you all for your engagement today. You can go to the next slide, Bruce. If you ever want to learn more, I know Glenda Francis is a part of your chapter, so I'm sure she'll be happy to tell you all about our work, but you can also email us at the addresses you see depicted here. Thank you again. I'll turn it back over to you, Bruce.
Great, thanks, Elise. Okay, let's go ahead and get started with Q&A. We've got about 15 or 20 minutes here. So if you would like to ask a question, go ahead and put it in chat and I can read it out, or go ahead and unmute yourself and you can ask your question directly. So looking forward to your questions.
As folks are preparing questions, I see that one of our partners is on. I'm making an assumption that Rita Norris is our partner from CareLink of Northwest Georgia. So just wanted to shout her out as being a trusted partner in our Paulding County community. She runs the CareLink of Northwest Georgia. And with her support, we've been able to do food distributions at a neighboring church in Paulding County. We've been able to get institutional support for operational dollars for her clinic because of her advocacy. So Rita, I just wanted to thank you for being here.
And Elise, let me just give a quick shout out to Cairo Kitchens. He has had some difficulties trying to get on, but Cairo Kitchen is the CEO of Good Sam, and he meant to be on the call, but technology has challenged him this morning.
Oh, well, that's too
No
bad.
problem.
And just for everyone, we are recording today's session, so later on I'll send out a copy of the recording along with the slide deck and our evaluation. So I do have a couple of questions here. First one, who are you accountable to within the organization to advance the work?
Thank
Please,
you.
I'd like to take that.
Yes, thank you, Bruce. So,
Glenda?
just operationally, we report up through population health. So my leader is Jessica Kowaleski, who is the Vice President of Population Health and Care Coordination here at Wellstar Health System. However, we are responsible for reporting out to, I mentioned those regional boards. There is a board, I don't know what you call it, a sub-board of the big board called the Community Advocacy and Engagement Committee, where I am also responsible for sharing information. Then the social determinants of health work is really being pushed by requirements that are coming from Centers for Medicare and Medicaid Services, CMS, guidelines through Joint Commission, et cetera. And so our safety and quality team is taking a lead role in ensuring that we are compliant with the rules and guidelines that are coming out, but also that we really make this part of our culture. So not just to check boxes, but to really be embedded in serving those additional needs of our patients and their families.
I have a question from Dwayne Hooks. Do you have any formal partnerships in Clayton County?
That's a good question. So Clayton County is not currently a part of our footprint. However, I have been connected to community clinic partners in that area. Family Health Centers of Georgia actually just took over one of our old graduate medical education clinic spaces. And so we maintain just partnership with area clinical providers in Clayton in order to ensure that there are access points for un- and underinsured. In terms of community-based partners in Clayton, we do not boast any.
All right. Here's another question for you. How do you leverage academic partnerships to inform the practice of addressing health equity?
So I mentioned that we are a partner of Georgia Health Policy Center, part of Georgia State University, in order to conduct our community health needs assessment. Glenda, may you share how we engaged with Georgia Health Health Policy Center just this past week or last week? You were part of a consortium.
Yes, we are intimately engaged with the Policy Center. Last week I attended a workshop where they are basically sharing some of the resources and organizations that are delivering some of the care and resources that these communities need, not just in the Atlanta area, but throughout Georgia. And there was a little saying that says, it referred to as GOA, and it's Georgia outside of Atlanta, because oftentimes we talk of Atlanta and we forget Atlanta is not Georgia. So we learned a lot about other resources that are out there, governmental resources, awards that have been granted. So we have a very good partnership with them, and we actually plan to continue to meet and engage wherever we are able to serve in whatever capacity. For instance, nutrition and physical education, lactation, and the like. So yes, we are engaged very closely with the Policy Center.
And Rayanne, can you share about our Clark Atlanta relationship?
Absolutely. So I am a social worker by trade, and we are connected with Clark Atlanta's MSW program. And so we are offering internship opportunities through Clark Atlanta's program to be able to help aspiring social workers understand health equity, social determinants of health. We are going to be looking at accepting our second student in the fall. Super excited about that. Our inaugural student was excellent. She was able to really support our graduate medical education clinic in Marietta in the assessment of social determinants of health and resource connection. And we look to really help our next student leverage a new opportunity to expand soul support a little bit more too as well. So excited for that, and happy to have that partnership with Clark Atlanta to do that.
During the COVID-19 pandemic, we partnered with Morehouse School of Medicine as part of their national COVID-19 resiliency network. And then as a subset of that, they had new funding through their Georgia SEAL program. And with their support, we were able to host English and Spanish language webinars and town halls for our faith communities to inform them about COVID-19, like the newest health information, the newest information on risk factors, how to get your congregations connected to testing and vaccine resources, etc. Morehouse School of Medicine also has a Center for Maternal Health Equity, and we've have a panelist coming up for our Women's Innovation Series next week, Dr. Natalie Hernandez, who will be a part of this white paper that will generate focus on how to build a public-private partnership to address women's health. So we stay intimately connected with academia, and I'm sure that will only grow now that we've expanded our footprint into the Augusta area.
And Elise, I just want to put a plug in for, of course, they're not academia, but it's Latinx organization that we partner with, So Familia. So we're able to provide bilingual community health workers, if you want to call them that, but to be able to reach these individuals whose first language is not English. So we have a very, very well coordinated relationship with So Familia in Marietta and beyond. So I just want to put a plug in here for them. They'll be trying to reach everybody where they are.
Thank you for that, Glenda. That was a great call out. And I want to mention something that we don't reference as necessarily our success, but is definitely a part of our ethos, and that is being an anchor institution, whereby we are just a connector for community-based organizations. So recently, Ser Familia came to us with a challenge. They said, we want to start a clinic, eventually become an FQHC. We need a medical director or a leader to support that work. And I knew that Wellstar institutionally couldn't probably do it in time, right? For them to get started when they wanted to. And so Glenda used the community clinic network to identify a Cobb County community clinic already functioning outside of Wellstar. And they said, hey, we can be supportive of what Ser Familia is trying to achieve. And another example of that, Our House, which is in Metro Atlanta, is provides housing for families in transition in addition to other resources. They said, we need a place to refer people to get clinical care. Again, Wellstar doesn't have a community clinic in that footprint, but we have a community clinic partner. And so we were able to make a connection for them. And that is just as important, I think, sometimes as us having our hands on the work. Yeah, I'll stop there.
All right, we have another question, and I just wanted to remind everyone, if you do want to ask a question via your microphone, just unmute yourself and you can ask it directly. But here's a question from Peggy Ramos. I'm a Wellstar Care Coordinator. I've been attending the Cobb collaborative meetings, primary focus on housing. I see that it is one of your goals on the website. What are your initiatives at this time?
We are in a learning phase, Peggy. I'll just be honest. So one solution is Wellstar Find Help, right? So Find Help does have an inventory and repository of housing resources. And our expectation is that our community team and our clinical providers inside of Wellstar's walls can begin referring people to those community-based resources listed on Find Help. Health systems, I've learned across the nation, take different approaches to addressing housing. Some of them become landlords. They're actually building housing or purchasing housing to help patients. Some just give capital into an affordable housing development. Some do, more intentional referrals. And so Wellstar is still exploring what our approach is going to look like. And so I'm pleased to hear that you're part of those conversations. I know that our population health teams, our EDs, and others are trying to figure out how do we create the right infrastructure and pipeline for housing resources. So more to come on that.
Thank you very much for all that. Appreciate it.
Yeah, no problem.
Okay, any other questions? I don't see any other questions. Glenda, Brianne, Elise, any closing comments?
Elise, you want to go?
You know what, Glenda? I'll let you take the floor. You initiated this. This is your community. I would love for you to share some closing words.
The one thing I would like to say is that I was hoping, based on past experiences, we would receive some questions regarding how can we get started? How can we create our Center for Health Equity in our own organization? So I was really expecting some questions in that regard, but maybe they'd come later on and they'd probably come in your evaluation. But I just wanted to take this time to thank the Georgia American College of Healthcare Executives leadership team for granting us the opportunity to share our stories with you. Bruce and Marion and Angela and the rest of the team, John Paul, they've been very cooperative, very amenable to us sharing our Center for Health Equity stories. So I thank them for that. It's a great organization. If some of you are not members, I will push a membership plug right here to, you can reach out to me because, I will recruit and I will, network a turnip given the opportunity. So if you need more information about the Center for Health Georgia ASHE, please reach out to me. But I thank you all so much for the work that we do in this community as a organization. And I pray that we'll continue to do even more work. There are so many opportunities for us to learn and grow as leaders. Every aspect of healthcare leadership, healthcare delivery, healthcare coordination, you always have something on your website that would help us to learn and grow. So I thank you for the opportunity to be here to share our story with you, and I hope and trust that you gained some knowledge from the presentation. And if you'd like to reach out to us, you have our information. If you want to reach out to learn more about the community health needs assessment, is publicly shared on our website. You can check that out and you will learn more about what we do as a system. Thank you kindly, and I will turn it back over to Bruce.
Thanks so much, Glenda, Rayanne, Elise, for a great discussion today. Thanks for sharing all the good work you're doing at Wellstar. And also want to thank our sponsors. Appreciate all you do to provide leadership for the healthcare industry in Georgia. And just as a reminder, be sure to complete our meeting evaluation, which will be emailed to you most likely in the morning. We're going to include a recording of today's session. It takes a little bit of time to edit that. So anyway, look for that. We'll include the slide deck, which the last slide, you can see there our panelists' contact information there, so you can get more information there. Be sure to self-report 1 hour of qualifying education credit on the WCHE website. So it looks like we'll give you guys a few minutes back in your day. And anyway, have a great afternoon and a great weekend. Hope to see a lot of you at our Lunch and Learn next Thursday at Maggiano's. And if not, hope to see you at another one of our events soon. Thanks again. Have a great day.
Thank you.
Thanks,
Thank
everyone.
you.
Bye-bye.
Bye-bye.
Thanks, everyone. Bye.